chronic urethritis. Usually, a history of an acute attack is obtained, but occasionally the patient becomes aware of her condition only when it is subacute or chronic. The urethra may alone be involved, or there may be an accompanying cervicitis or cystitis. The discharge in these cases shows, as a rule, pus and epithelium cells and pyogenic organisms, the gonococcus often being found with difficulty. Symptoms. Frequency of urination is the symptom most often found. This frequency occurs during the day when the patient is in the upright position and may also be complained of at night. In milder cases, the patient complains of an occasional, quote, tickling or, quote, burning on urination, and this may be very intermittent in character. Examination. By massaging the urethra through the vagina, a thick mucopurulent secretion can be obtained. This, when examined microscopically, may be found to consist of epithelium and pus cells and no gonococci present. The urethra in these chronic cases is generally found somewhat indurated and tender on palpation. After the urethra has been emptied of its secretion and this wiped off, a more thorough massage over Skene's glands may bring a tiny drop of pus to each duct. Oftentimes, the gonococcus will be found here when it has disappeared from the urethral discharge proper. It may be of value to ascertain whether the anterior or posterior portion of the urethra is chiefly involved. By massaging first the anterior portion and later the posterior, a rough estimate of the involvement can be obtained. Examination by the endoscope may show local areas of congestion and erosion in the course of the urethra. Treatment. The general treatment is the continuance of a simple diet without the use of condiments or alcohol. The internal drugs commonly used are the same as prescribed for male patients. See page 218. Local treatment is accomplished by the application of the various silver salts to the urethral mucosa. This can be done by means of a glass medicine dropper or by bladder irrigations, page 207. These treatments should be given 3 times a week, later twice a week. If localized erosions are discovered, these should be touched up with silver nitrate 5% with the aid of the endoscope. If this process is painful, it may be necessary to first anesthetize the urethra. This can readily be done by inserting a fine applicator wound with cotton dipped in alpine 5%. In certain resistant cases, the application of urethral pencils is very useful. These are variously prepared, containing various medicaments, as silver nitrate, proterol, argyrol, icthargan, or astringents such as zinc sulfate. Astringents are of great value in the later stages of urethritis. These pencils have the double value of acting mechanically as a small sound to dilate the urethra. They should be lubricated with a sterile lubricant before inserting. Complications. If persistent involvement of Skene's glands continues long after the urethritis has been controlled, it may be necessary to split open these little glands. This can be done by means of a fine scissors under local anesthesia. The glands and duct should then be swabbed out with carbolic acid, 95%, followed by alcohol, or with a strong 30 to 50% silver nitrate or silver stick. Caruncles may form in the irritated and hypertrophied mucous membrane around Skene's glands. Stricture of the urethra is relatively rare in women and should be treated by dilating with a female urethral sound. Care should be taken that the dilation is not too great, as the urethral wall may easily be injured. Dilatation up to 28 to 30 French is sufficient.